One of the many issues that I've overcome on a personal level has to do with hormone balance. Turns out that if you have a lot of stress in your life and you're a woman, you might end up depleting your progesterone. What happens as a consequence is that estrogen ends up either more active because progesterone isn't there to neutralize it, or you actually have estrogen levels that are too high. We call this situation estrogen dominance. The way that it actually presents is difficulty losing weight, emotions that are very loud. So they're not necessarily inappropriate emotions, but the volume and magnitude of them seems so much bigger than it really is. So don't worry, you're not actually crazy, you're just feeling things a lot. Highs are really high, lows are really low, and hopefully having just a little bit of clarity that what you're really feeling is okay. You just don't have to take it as seriously. Estrogen dominance can cause a number of other issues like blood sugar imbalance and insulin resistance. When we have insulin resistance and estrogen dominance, this can then impact our ovaries and create polycystic ovary syndrome as well. Sometimes this ends up resulting in the growth of facial hair for women. It can end up resulting in missed periods or very, very long periods. So if you've noticed weight gain or weight that's difficult to lose, in addition to some short-term memory loss, some emotions that seem very, very strong, or your periods have become irregular, you might be towing the line on estrogen dominance. If you've also had a season of unusually high stress for the last several months before this started, the odds are even higher. So the question is, how do we fix it? Well, really it all comes down to lifestyle, and it takes a lot of time to truly get it right. It took me about 9 months of very intensive care. I had to work with my liver quite a lot, and I had to change what I was eating. It turns out that some of our vegetables help our liver clear estrogen. That's the family of cruciferous vegetables. They got their name because there's a cross on them and they were named after the crucifix. But what makes them unique is that they have sulfur in them, and that sulfur component helps the liver remove estrogen. Familiar ones include broccoli, cauliflower, cabbage, kale, Brussels sprouts, and my personal favorite is bok choy. Raw or sauteed, bok choy is the bomb. So, a cup a day of any of those cruciferous vegetables, raw, gently steamed, or sauteed, turns out to reduce breast cancer incidence by about 50%, because estrogen causes tissue growth in our breast tissue. And if you make that one change, not only are you helping the liver get more sulfur, but you're also helping the colon get more fiber. If you have constipation in this situation, it's very serious that you rectify this. There's this kind of creepy situation where we recycle the stuff we try to dump. If what your liver put in your colon stays there too long, you take it back up again. There's a fancy name for it, but it's got too many syllables for this setting. Point is, you need fiber so that you can bind what you're dumping and make sure you're getting rid of it. If you're not pooping every day, you're constipated. Even if you've only been pooping twice a week your whole life, you've been constipated your whole life. We have to let you know that's not normal, even if it's been typical for you. So when it comes to resolving these symptoms of estrogen dominance, in order to really treat the root cause, we have to look at these constant, chronic, low levels of stress. It's that mentality of, oh, what do I have to do next while you're finishing that last thing, and what time is it, and when can I get here and there, and what else is going to happen, and what about tomorrow, and what about yesterday. All of those things induce constant, chronic, low levels of stress. What that does is it increases our cortisol. Cortisol is the chemical that the body uses to tell us that we're in danger. What it does is it takes away from our resources. It says we don't have time to get better. What we have to do is get out of here right now. So, one of the resources that it consumes is progesterone. It turns out that cortisol and progesterone are both made from the same hormone. It's called pregnenolone. If we have so much stress that we use all of our pregnenolone for cortisol, there's just none left for progesterone. Some people are of the thought that if we simply add progesterone, we will balance the estrogen dominance. And to some extent that's true. It can help us feel better for many of the symptoms of estrogen dominance. And sometimes it is appropriate to make that balance happen a little faster. But the real root cause is what we call that pregnenolone steal. What we need to do truly is keep the cortisol down. Turns out that being hungry increases cortisol. Many of my patients, I find, are not eating enough food. They're simply not eating often enough, and they're not necessarily having enough calories when they do eat. This is typically because they're overweight. They're afraid that if they eat too much, they won't be able to lose weight. However, being hungry is so stressful for the body that they won't lose weight until we train them that it's okay and they're not starving anymore. Normally, when cortisol gently wakes us up in the morning, it's because we're hungry. We call it breakfast because we're breaking that fast overnight that naturally woke us up. Another thing to consider is how well is the liver operating. As I mentioned a little bit earlier, our cruciferous vegetables have a lot of the resources that the liver needs to clean out estrogen. There are a few supplements that we can also consider, but one of the things that really made the difference for me was gentle activity. The liver is a filter for the blood. If you move more blood through the filter, you'll get cleaner blood, right? This made sense to me, so I just did a gentle 30 minutes on an elliptical most days of the week, probably 5 or 6, and you want to break a gentle sweat. However, you should still be able to talk. You should still have just enough breath to hold a conversation. This is one of the things you can do. Another is to make sure that you're sleeping. Our sleep is so important. We'll talk about it in a whole nother video for you.